Hi, I'm Dr. Patty Ann Ford, and today we're going to talk about cholesterol and heart attack risk. There is some conversation happening, at least in my world, about what does that mean? What does it mean to look at my cholesterol, and what's some of the new information that's out there? There's a lot of talk around heart and cholesterol and inflammation, and how do we know if we're inflamed? What does that feel like? Some people talk about cortisol, some people talk about fluid buildup. Some good markers, if you were to go get your blood lipids checked, I would recommend a 12-hour fasting test. So don't eat for 12 hours and then get your blood taken and then analyze your blood lipids. One ratio that isn't too commonly known and looked at, you're going to look at your ratio of your triglycerides to your high density lipoproteins, or your HDL. So lipoproteins are a type of fat that's in your blood that have been looked at for a risk factor for heart disease. So if you have total cholesterol that's over 200, typically they're going to start to watch it and say, okay, do we need to lower it? It could be reflective of lifestyle, stress, smoking. It also could be reflective of genetics. They're saying now if we look at the ratio of triglycerides over high density lipoproteins, or HDL, and that ratio is over 2, that is actually a better marker for heart disease than looking at your LDL, which is your low density lipoproteins, which have been shown to be inflammatory or a risk for atherosclerosis, which the potential of more atherosclerosis, which is plaque buildup, especially if you smoke or have a high stressful life or reaction to events where you feel like you have a lot of cortisol, less sleep, that could be oxidized, which causes that hard plaque buildup, and it's very slow. So looking at those two numbers, your total cholesterol and then your LDL, is good, but then also looking at your ratio of your triglycerides to your HDL can be reflective of a few things in terms of dietary patterns. So I'm not a medical doctor. I'm a doctor of preventive care, where I can look at these things. I can't diagnose, but I can look at some of these risk factors and say, okay, let's work with your medical doctor, or let's work with the people that are prescribing, and let's just have a conversation. So a lot of my practice sometimes feels like coaching, where it's someone that kind of looks at the full picture and helps to step into your life to help you move forward. So can work with your therapist, doctor. I am a dietitian. I do have a practice where I work with people in medical nutrition therapy. But outside of that, I can kind of act, it feels kind of like a case coordinator, but also where I can be in your life in real time, where we say, okay, let's look at dietary behaviors that can contribute to triglycerides. So one is going to be sugar intake, overall food intake, alcohol intake, and those types of patterns. So it's not just fructose or fruit or dairy or grains. It can be added sugars in packaged foods. It also could be things like honey. It also could be maybe you are engaging in intermittent fasting, and what are you having when you break the fast? Because that can affect the gut, which affects how you absorb food later on. So many different things, but if I was working with someone that had elevated triglycerides, I would want to look at their meal timing or their pattern. I would want to look at the types of fluids they're drinking, and if it had added sugars. I would want to know about their alcohol intake. And then I would look at the types of foods that they're eating and what foods do or don't have sugars. And then lastly, I would want to figure out how much fiber they're having. So foods I would want to increase is fiber. And that could be from whole grains, that could be from fruits, that could be from vegetables. If they have an elevated hemoglobin A1C, I would watch the fruit intake on an empty stomach, and I would watch the portions. So there's a couple different things that you can look at. As a dietitian, you look at the totality of it and then what happens over time, not just a weekend warrior or not just a Monday, but over a 3-month period, what does frequency of fiber intake look like? So a lot of these dietary behaviors take time, and a lot of times insurance or people will come in for one session. What really has been shown to be impactful is at least 3 to 6 months of someone partnering with you to make changes over time, and that is true change. And a lot of times people don't want to invest in any medication or any sort of artificial help or like biohacking. And so they want to work on behaviors. You just need to be able to commit to a longer time frame. And that work is much slower and typically requires a safer interaction. And so anyway, so if you take a look at your ratio of triglycerides over HDL and then slowly make changes over time, you should see changes in 3 to 6 months. Hope this helps.